Let's switch gears a little bit,
Okay.
and let's talk about West Nile virus.
Mm-hmm.
That's something that you're dealing with maybe on a daily basis.
Yes.
What is West Nile virus?
Well, West Nile virus is one of those mosquito-borne diseases that actually causes a systemic viral infection in your body. And for most people who are bitten by a mosquito carrying West Nile virus or carrying the West Nile virus, they may have just a very mild febrile. A few days, they feel bad, they have a low-grade fever, maybe a little bit of a headache, and they'll be done. We call that West Nile virus fever. But for a certain percentage of the population, especially if those folks that are a little bit older or their immune system doesn't function as well, they may have diabetes or something, they may have more of a neuroinvasive disease. They may actually progress to where now they have inflammation in the brain, and either it may just be a mild inflammation with the meninges or the covering of the brain, or it may actually get into the brain tissue itself called encephalitis. For those people, they may have a more challenging course, will certainly require hospitalization. And for many of them, they may have some long-term consequences in terms of memory function, in terms of fatigue that just won't go away for several weeks to months. Those people have a more protracted course. And then in less than 1% of the population, they may have a very serious outcome in terms of maybe paralysis or death or something like that. So for the vast majority of people, it's going to be, a nuisance type of disease. But for some people, it's going to be very serious.
What should we do to protect ourselves?
Mosquito repellent. That's the biggest thing. You live in a living environment. Whenever you go outside, day or night, when you're going outside, if you're going to be out for more than just a couple minutes, you need to put on mosquito repellent. There are also mosquitoes that transmit viruses during the day that are especially dangerous for children. Lacrosse encephalitis is one that's a daytime. It's a very aggressive biting mosquito. It's a different mosquito that carries that virus. And a certain percentage of the kids, I think it's about 1/3 of the kids that have that may be left with a subsequent learning disability or in a very rare number of cases, you can actually even have death from that. But that's a daytime mosquito. So whenever you're outside, if your kids are going to band practice, if your kids are going to be out on the football field, if they're going to play soccer, if they're going to be outside, you're going to go for a bike ride. Yes, I know you're moving, but you are going to stop at some point. Just spray on the mosquito repellent. There are some natural compounds that last as long as the lower level concentrations of DEET. So there's really no excuse for people anymore not to wear mosquito repellent. And that's the best protection.
Okay.